Hi there, and welcome to my channel. My name is Ngozi Onoha. I'm a health content creator, and I want to wish you a happy holiday season and a happy, blessed, and healthy 2025. Today is December 21st, and I saw an article on the news that was very interesting, and I wanted to discuss it here. So it's on the approval of a medication called Zepbound for sleep apnea. So I'm going to give you some information on what Zepbound is, what sleep apnea is, and why this is an exciting development in the management of sleep apnea. So yesterday, which was December the 20th, the US Food and Drug Administration has approved a medication called Zepbound, which is also called tirzepatide, for the treatment of moderate to severe obstructive sleep apnea in adults with obesity. And this is to be used in conjunction with a reduced caloric diet and increased physical activity. So, this particular medication, Zepbound, was also FDA approved for weight management in people with obesity. And obesity, by definition, is a body mass index of 30 or greater. It was also approved for people who are overweight with a body mass index of 27 or greater, with at least one weight related condition, such as high blood pressure, diabetes, or high cholesterol, and for use in addition to a reduced caloric diet and increased physical activity. So let's talk about sleep apnea. I'm sure lots of you have heard about people who have sleep apnea. And sleep apnea, there are two types of sleep apnea. There's a central sleep apnea and there's the obstructive sleep apnea. So, for this purpose, we're going to be talking about the obstructive sleep apnea. And this sleep apnea is typically related to being overweight or obese, and it occurs when the airway gets blocked repeatedly during sleep, and it causes that person to stop breathing for short amounts of time. So, what happens during um, that stop breathing for short amounts of time is that the body doesn't get adequate oxygenation. So, you'll often find that that person has some daytime fatigue and sleepiness because they don't have refreshed sleep because of this sleep apnea. The sleep apnea interrupts their sleep as well because sometimes they'll wake up in the middle of the night because they are choking or they've stopped breathing and their body needs oxygen. So they don't have rested sleep. So sleep apnea can be a condition that affects the way oxygen gets into the body, and it increases the risk for many health problems, including high blood pressure, heart attacks, and strokes. And you may find that somebody with sleep apnea has high blood pressure that is very difficult to control. That difficult to control blood pressure could be a manifestation that that person has sleep apnea. And the researchers have found that sleep apnea is more common amongst people who are Black, Hispanic, Native American adults than among white adults. So let's go back a little bit and talk about the GLP-1 receptor agonists, of which Zepbound is one of them. And so there are quite a bunch of them in the market. They're typically used for uh, diabetes as well as weight control. And what they do, how they act on the bowel and they reduce appetite and reduce food intake. So there are other mechanisms by which they work, but they ultimately result in a reduction in appetite, and then thereby they cause weight loss. So the statistics on obesity is that 70% of American adults have obesity or overweight, and many of those overweight have weight related conditions, as mentioned earlier. So we talked about high blood pressure, diabetes, high cholesterol, and heart disease. And so losing 5 to 10% of body weight has been linked with reducing the risk of cardiovascular disease in adults with obesity or who are overweight. And by reducing the body weight, studies have shown that Zepbound also improves obstructive sleep apnea. So, as earlier mentioned, I talked about how Zepbound works in reducing appetite and food intake. So, Zepbound is an injection that's given under the skin once a week. So, like everything, it's got some side effects, which people need to be aware of so they can make informed decisions about their own health. And here I'm providing information as health education. It is not medical advice. And so some of the side effects of Zepbound, we're talking about side effects that are gastrointestinal side effects. So we're talking about things like nausea, diarrhea, vomiting, constipation, abdominal discomfort and pain, and then injection at the site, uh, fatigue, allergic reactions, and gastric reflux. Now, in a study, um, they found that Zepbound causes thyroid cell tumors rather in rats. So it is not known whether they cause such tumors in humans. However, because of this finding in rats, they have suggested that or recommended that Zepbound should not be used in people who've had a personal or family history of medullary thyroid cancer, or in people who have a condition called multiple endocrine neoplasia syndrome type 2. So, this is important. If somebody has had a family history or personal history of medullary thyroid cancer, or they have multiple endocrine neoplasia syndrome type 2, they should not be on Zepbound. Now, there are other side effects of Zepbound. Zepbound has not been studied in people who have history of pancreatitis, which is inflammation of the pancreas, or people with severe gastroparesis. So now all this information is available online. If you go on the internet and you Google it, you're going to find all this information. The sources for this presentation came from the CDC website, the FDA website, and the NIH website. So all this is freely available online. What I've done today is just packaged everything into this nice little video that you can share with your friends, basically telling you that there's this medication that's been approved for sleep apnea. Um, Prior to this medication being approved, sleep apnea has been kind of tough for many people because uh, one of the mainstay of sleep apnea treatment is the CPAP machine, which many do not find comfortable to sleep in. And so there are issues sometimes with compliance. And so And then, when the CPAP machine doesn't work, and then people are offered surgery as an option to treat sleep apnea. But with this medication, it's a very exciting development because it's not invasive, it's an injection weekly. And I hope it will be accessible to many people who need it. So I brought this here today as education only, because this is new, and I'm sure that uh, you know people haven't heard about this. And I thought I'd just put it out there. And if you found this video educational, please like it on YouTube and please share it. It does help with the brand, and it helps me make more videos. So thank you so much for watching, and bye for now.